Great. Hasn't, there we go. Okay, John.
Okay, good afternoon, everyone, or afternoon. It could be morning, especially where Dave is, and could be evening too. But welcome from wherever you are. We're here to talk about the wildfire smoke, and we have Dr. Dave Stieb from Health Canada with us. And I'll just go through a bit of introduction, allow some of our latecomers to come also. First of all, we've seen something new in our Environment Canada weather, these smoke symbols, which is new for us here in Eastern Canada, although as Dave has reminded me, they've seen it in Western Canada for quite a few years now. Climate change has been causing the increase of carbon dioxide levels. I started measuring them back in the 1980s when they were around 330, and now they're around 430. So in my career, I've seen it go up almost 100 parts per million. And that increases the temperature and decreases the humidity, and causes conditions for burns. And then we get more carbon dioxide, which feeds the cycle of global warming. Here's a picture of what happened in Eastern North America on June 7th. It was called an unprecedented unprecedented for the East. But you can see the dark purple is where the highest concentration of smoke was detected, and even hit New York City. New York City's previous highest amount of particulate, 2.5, was 86, and this was 100 times higher, 10 times, 100. Yeah, 10 times higher than the value of previous time. And it even, if you look at the map here, it even reached Europe. This is this morning's levels, and if you look at Iceland there, where they have the volcano currently erupting, you see that the smoke doesn't even make an impact compared to the forest fire smoke. Now, this weekend I was in Edmonton, and you can see that that's where the smoke is concentrated right now in Alberta and northern BC. And we landed just in one of these purple sections and stayed a few days. And I had to wear a mask one day just to, when I went for my daily constitutional. And today they're looking at an AQHI of 5. The maps are all AQI, but this is AQHI. And if you're wondering where this AQHI came from, I looked it up, and sure enough, here's the paper by Dave Stieb and Richard Burnett, where the original AQHI came from. If you can turn off your microphone, that would be appreciated. Thank you. Now, if you're wondering how to calculate it, I found the equation in the paper, and every time I see one of these equations, I just have to create a spreadsheet that will calculate it out. And so I did that. And the worst part was trying to get the colors right. In order to get the colors, you actually have to go to the hex code in order to get them right. Anyway, the AQHI advice in that paper is still the same as it is now. And I'm sure you'll see it, and I'm sure Dave will go over that. But we also found a paper, again, with Dave as one of the co-authors, about the assessment of the AQHI and an adjustment for it for the wildfire season in British Columbia. So instead of taking a 3-hour average measurement according to a complicated equation you just saw, you actually just take the 1 hour level and divide it by 10. So this is the AQHI equation, and here's the simplified version. And you can see that it gives you a higher level of concern based on the same numbers. So, Dave Stieb, thank you for joining us. And to introduce you a bit, Dave Stieb has been part of Health Canada for many years in the environmental health science. He's also a professor in School of Epidemiology and Public Health and Preventive Medicine. And he has done a lot of primary research linking large databases of exposures and health care records, and also done systematic reviews and meta-analysis of such epidemiological studies on air pollution and health. He's also been very active in knowledge translation, and including creating the Air Quality Health Index, and also another tool called the Air Quality Benefits Assessment Tool, which calculates the costs and the savings if you reduce exposure to PM 2.5. This is the web page of Dave, and he's took his medical degree at Queen's and also got a master's in health research at McMaster, and also did his public health residency there. And another one of his key publications is the health impact of 2.5 PM or particle matter 2.5 from wildfire smoke in Canada, where he looked at results in Western Canada and found that hundreds to thousands of premature deaths per year were attributable to wildfire PM 2.5, and the costs were also very into the billions. And just as a side note, he also spent some time working at OHCOW at the beginning of his career, and I think it's really great to be able to introduce him, and near the closing of his career that he could be back again. And welcome, Dave.
All right, thanks very much, John. Let me just share my screen. So, John, can you just confirm that you're seeing my screen okay?
Yes, I am.
Okay, that's great. Well, thanks very much for having me. I have to say I was really glad to hear from John after many years. Like John mentioned, when I was doing my public health training at McMaster back in the early 90s, I spent a considerable amount of time at the OHCOW clinic in Hamilton, first when it was on Barton Street, and then when it moved up to Main Street. I'm not sure where it's located now. And then later on in the late 90s and early 2000s, I worked at what at the time was a satellite clinic in Ottawa, and Lori Brown and Cheryl Rook, the occupational health nurses from the Toronto clinic, used to come up periodically, and we'd see patients together at the Sandy Hill Community Health Center. So it's nice to be back as I'm about to retire. So yeah, I'm glad to be talking with you today about non-occupational exposure to wildfire smoke and health. And you know, obviously, like John was alluding to, this has certainly been in the news a lot, even with international media coverage, often describing the situation as unprecedented. And I noticed you picked up on that as well, John. You know, off the charts, extreme, record breaking. So clearly there's something different about this wildfire season compared to the average season. And actually, just before I get any further, I wanted to just mention that I actually prefer, if you have questions or comments, that you just put up your hand and let me know or let John know as we go along. And I think it just makes it a little bit more interactive if we kind of take questions as we proceed rather than leaving everything till the end. So don't be shy. And I'm sure everyone's seen these photographs in the media of just how extensively the smoke has spread across North America. So Montreal, Calgary, Toronto, all across Canada. And even like John indicated, New York City, Washington, Pittsburgh, and the list really goes on. So it just goes to show how far the smoke has spread. Speaking of which, this is just a screenshot from the fire smoke website, and I'll say a little bit more about this website later. So just showing in this case, this is from early June, the sources of the fires in northern Alberta and northern Ontario and Quebec, and just how far the smoke plume was spreading. So you'd even get these elevated concentrations in the northeastern US at the time, and spreading down as far as the southern US. And we, like I had indicated, the media coverage is indicating how unprecedented the situation is this season. And we're only about halfway through the season, and already about 11 million hectares have burned so far. That number obviously is just going to continue to go up compared to the average season, where we tend to see about 2.5 million hectares. So clearly, there's something very different about this wildfire season. So I just wanted to turn to a bit of sort of wildfire smoke 101, just to go over some of the basics. So not surprisingly, where there are trees, and in Canada, that really is the boreal forest, and this shows the distribution across Canada. Where there are trees, there's fire. And so this shows the distribution of fire locations between 1980 and 2020, and you can see basically it follows the distribution of the boreal forest plus the interior BC. That's where the fire activity typically is concentrated. And another sort of key concept in this area as well is the wildland urban interface, or WUI. And these are some nice maps that were published in the Globe and Mail last month, I think, just showing how settled areas are increasingly encroaching on forested areas. So the settled areas are shown in brown color. This is Kelowna, BC, and then you have Halifax and Fort Chipewyan in Alberta. And so the point is just that there's an increasing encroachment of settled areas in proximity to forests. And this is a result of urban planning decisions. And so one of the issues that this gives rise to is that it can change the mix of emissions when you're not just burning forests or other vegetation. When you start burning human-built structures, then that changes the composition of emissions in important ways. And the Globe also made this point about a lack of risk data and mapping in relation to this concept of the wildland urban interface. So speaking of emissions from wildfires, emissions consist of a mixture of particulate matter and volatile organic compounds and gases. And so these are emitted directly, but then they also undergo chemical interactions in the atmosphere to form secondary pollutants like other types of particles and gases like ozone. And now one of the most concerning elements of this emission mixture is particulate matter, and especially the fine particulate matter referred to as PM2.5, meaning the average diameter of the particles is less than 2.5 microns. And so this is about 1/20th of the diameter of a human hair, just for comparison. And so the reason that these fine particles are particularly concerning is that we know they can penetrate deep into the lungs and contribute to health effects through a number of different mechanisms. So just getting back to this concept that this wildfire season is unprecedented. That's true, it's unprecedented, but certainly not unexpected. We know that the impacts of climate change are complex and they affect all types of systems on the earth and the atmosphere. But just to hone in a little bit specifically, experts have obviously been predicting for years that with climate change, there'd be an increased frequency and severity of fire. So we have drought conditions, increased frequency of fires, giving rise in particular to particulate air pollution that can contribute to both cardiovascular and respiratory health effects. And I'll say a bit more specifically about those in a few moments. So the one kind of general point to make about health effects of PM 2.5 and other pollutants that may be a little bit different from how exposures are often looked at in an occupational setting is that generally the evidence suggests that there's no threshold for adverse effects. So you see effects basically in a linear fashion down to low pollutant concentrations or even zero. And you can see this if you look at the Canadian ambient air quality standards, for instance, that standards basically are expressed as values that decrease in small increments over the years as basically targets for reducing population exposure. And similarly, sorry, I'm just going to move this little gray box out of the field of view here. Similarly for the
now, Dave.
Okay,
So
great.
It's gone.
Similarly for the WHO air quality guidelines, that there are a number of interim targets that are basically increments, small increments over time in reducing exposure, and recognizing that even at the lowest levels of exposure, these values are not considered 100% safe. So they're essentially targets to continuously improve air quality. So who's at greater risk? And I think probably not a lot of surprises here. Children, because of their developing immune and respiratory systems, they also tend to spend more time outdoors and engage in more intense physical activity when outdoors. They also have a larger air intake per kilogram of body weight, so basically an increased dose per body weight. Seniors, because of their increased sort of physiological frailty. Also individuals with chronic disease, including lung disease like asthma and chronic obstructive lung disease, heart disease, and diabetes, because this compromises respiratory and circulatory physiology. Pregnant people, because of the developing fetus. Outdoor workers, as I'm sure you're aware, who spend more time outdoors and are generally involved in a greater intensity of outdoor activity. And I did notice that at certain times during the smoke episodes in Eastern Canada earlier in the year that I believe postal delivery was suspended in some areas to reduce exposure of letter carriers, just as an example. Also, lower socioeconomic status, which may lead to reduced access to healthy diets and medical care, including necessary medications. And finally, inadequate dietary antioxidant intake. So things like vitamin C and E, that help manage oxidative stress, which is one of the mechanisms through which air pollution leads to adverse health effects. So one obvious question that arises from this idea of populations at greater risk is just how common is it? What percentage of the population falls into these categories? So we did this analysis a few years ago using data from the census and health surveys. And so what we found was that if we look at the youngest children and the oldest seniors, so children less than 10 and seniors 75 and over, plus those with asthma, COPD, heart disease, and diabetes, and pregnant people, then it turns out that on average, among the 100 or so health regions that we looked at across Canada, about a third of the population fell into one of these groups. And then if we expand that definition to include outdoor workers, those with less than a high school education as a measure of lower socioeconomic status, those with inadequate vitamin C intake, and older children and younger seniors, then the average prevalence in the population actually is over 2/3, so up to around 70%. So the short answer basically here is that a substantial proportion of the population could be considered at greater risk to experience adverse health effects of air pollution. And, we're obviously hearing all the time how the population is aging. There's a greater proportion of seniors in the population over time. So, so that'll obviously affect the prevalence of or the size of the population that's going to be at risk from adverse effects of air pollution. Another group that's particularly at risk with respect to wildfire smoke is Indigenous populations who are often in remote communities located closer to fire activity. And residents may be more susceptible to adverse health effects for a number of reasons, but in particular, greater time spent outdoors in more strenuous activity. And finally, one of the other issues is that data on PM 2.5 exposures are often unavailable due to a lack of routine monitoring in remote areas. And so we do have a project that just got started last year working with Indigenous partners. It's called the Smoke Data Knowledge Exchange Project. And so the idea here is to share other sources of data that may help Indigenous communities to get a better handle on their exposures. And again, just to emphasize this point about the lack of routine monitoring data in remote communities. So these are the government National Air Pollution Surveillance Program monitoring sites across Canada. And you can see that they're mostly concentrated in southern urban areas. So that's a problem for obviously remote communities in terms of accessing information about their own exposures. So moving on to actual adverse health effects. So these slides show the effects of PM 2.5 in general. So most of this is probably true of wildfire related PM 2.5, but in general, the sort of size of the evidence base is less for wildfire smoke than kind of the PM 2.5 in general. So it's kind of a developing area of research and evidence. So on the respiratory side, you have these typical respiratory symptoms reflective of irritation of the airways, as well as increased morbidity and mortality from pre-existing disease like asthma, chronic bronchitis, emphysema, and pneumonia. and then also development of new disease. So this may include asthma, chronic bronchitis, and sort of premature aging of the lungs. Although just a point here, like I mentioned, that the evidence for these effects of long-term exposure isn't as well developed for specifically wildfire-related PM 2.5 as it is for PM 2.5 in general. There are also well-recognized cardiovascular effects from PM 2.5 exposure. So the types of symptoms as shown there that typically reflect the conditions shown here, and we see increased morbidity and mortality from these conditions: coronary artery disease, cardiac arrhythmias, and heart failure. And in terms of mechanisms of effects, again, this is based on the overall literature on PM 2.5, but these mechanisms probably do operate also for PM 2.5, specifically from wildfire smoke exposure. So effects on lung function, narrowing of airways or bronchoconstriction and decreased airflow, also inflammation, where you'll see influx of white blood cells, abnormal mucus production, swelling or edema in airways, and cell death. Also increased susceptibility to respiratory infection. Similarly, mechanisms for cardiovascular effects. Again, effects on cardiovascular function, so reduced ability of the blood to carry oxygen, cardiac arrhythmias, and altered autonomic nervous system control of the heart. And then again, similar to the respiratory system, inflammation, so increased risk of blood clotting, vasoconstriction, narrowing of blood vessels, and increased risk of atherosclerotic plaque rupture. And then one area of adverse health effects that's emerged a little more recently is impacts on birth outcomes. And so you can see that there have been a couple of relatively recent systematic reviews that have reviewed the evidence in this area, specifically around wildfire smoke exposure. And they both concluded that the evidence suggests that wildfire smoke is linked to outcomes like reduced birth weight and preterm birth. But there certainly is room for more research to confirm these findings in different settings, and to try to understand more clearly the impacts of the types of exposures that are seen specifically with wildfire smoke. Just also to expand a little bit on the point I made earlier about impacts on Indigenous communities. So my colleague Rosalind Miles, whose picture is shown here at UBC, she and her team developed this really nice educational toolkit for understanding air quality that's focused specifically on Indigenous populations, and making the important point that effects of wildfire smoke are not strictly physical. They're also spiritual, emotional, and mental health effects, in particular in Indigenous communities that are subjected to repeated evacuations over the years, or the threat of evacuations. That obviously can have serious mental and emotional impacts. And finally, just to point out that sadly, these health effects are very real. And I'm sure you heard about the case of this 9-year-old in BC earlier this month, who a child with asthma who died in the emergency department. And in all likelihood, the asthma episode that caused his death was triggered in all likelihood by wildfire smoke exposure. So I wanted to move on then to talk about effective interventions to reduce exposure and health effects. So first of all, being prepared at a personal level, so ensuring an adequate supply of rescue medication. So um, whether that's for asthma, as shown here, having inhaler rescue medication, or for cardiac disease, angina, having rescue medication, an adequate supply of rescue medication available. And sorry, I just noticed a comment or a question popping up in the on the screen. John, is that something that we want to address now?
Sure. It was relates to what you had just previously talked about.
And yeah, sorry, I can't see the
Okay.
comment anymore.
Is there research going on to study the composition of wildfire smoke and which components, such as carbon black or black carbon, cause which health effects?
Yeah, that's an excellent question. And one of the issues that's obviously challenging in terms of research on wildfire smoke is that because exposures are episodic, it's sometimes more difficult to have the measurement equipment readily available to be able to capture exposures in in a way that allows you to distinguish among the different actual components and how that might differ depending on the type of fuel, whether that's different types of vegetation or when there's actually human-built structures being burned as well. So that's one of the difficulties, one of the challenges in measuring differences in composition and looking at whether that makes a difference in terms of impact. But that certainly is an active area of research, but not one where we can say with confidence at this point that a certain different types of smoke composition have different types of health effects. So hopefully that answers that question, but I'm happy to return to it later. Were there others, John, just while we're stopped?
No, Denny just said fascinating. Thank you.
Okay, great, thanks. So just other aspects of being prepared, knowing if you're a homeowner, your HVAC system, and installing the highest possible efficiency filter that can be used for that system. Also, knowing how to close the fresh air intake or set it to recirculate during smoke events, and ensuring that windows and doors are tightly sealed when they're closed, so there's less opportunity for smoke to penetrate indoors. And of course, if you're not a homeowner, if you're in a rental apartment and it's not possible for you to reduce your exposure at home, then knowing where there's a clean air shelter. So normally a public building that has air conditioning and filtered air. And just to also raise the point that often dangerous heat and wildfire smoke occur together. So it'll be important to be in an indoor environment that's both cooled and where there's filtered air to reduce wildfire smoke exposure. So one other aspect of being prepared is monitoring air quality conditions. So there are a few different ways of doing that, and John actually mentioned some of these already in his introduction. So we have the AirQuality Health Index, or AQHI, the Environment and Climate Change Canada Smoke Forecast, firesmoke.ca, and then the University of Northern British Columbia small low-cost sensor map. And so I'll say a bit more about each one of these in a little bit more detail. So starting with the AQHI, or Air Quality Health Index. So it's funny, John, you also showed the AQHI for Edmonton in your introduction. And so basically just to point out in general that the AQHI consists of a numeric value on a 1 to 10 plus scale, a category from low risk to very high health risk, a color scheme, and then health messages for both the at-risk population that we've already talked about and the general population. And you can see also in this instance where the AQHI was rated as 10 plus in Edmonton, that there's also a special air quality statement. And this is something that's issued by Environment and Climate Change Canada in coordination with provincial ministries of environment, that just provides some additional information on the source of the high air pollution levels, in this case related to wildfire smoke, and some of the additional measures that might be appropriate in that situation. So there's also a forecast that's provided, and the idea here is to allow people to be able to plan their outdoor activities to time periods when air pollution levels might be lower. And John also showed this table of the health messages at the various levels of health risk, and also for at-risk and general population. So you can see that the recommendations for changing activities become more precautionary as the Air Quality Health Index level increases and the category moves from low risk to very high risk. And also that the messages are stronger for the at-risk population compared to the general population. And so I'll just go live to the AQHI webpage. So just to confirm, John, are you seeing now the AQHI webpage and the ratings for various cities? Okay. Yeah, so you can look, there's kind of a handful of cities that's shown on the main page, and you can see at this point, Fort Smith is up in the very high health risk range. And if you want to look in more detail at individual provinces, it looks like things are pretty good in Ontario right now. So if you want to look at Hamilton, downtown, it provides the information like I was showing earlier for Edmonton, including the forecast. So just to give you a little bit more of a orientation to the AQHI and what type of information is available. So just seeing a question popping up, but it just disappeared on me, John.
It's from Lynn. How can AQHI be interpreted in relation to the AQI? I guess there's a guide sheet that demonstrates how to translate from one to the other.
Actually, I'm not aware that that there is such a guide sheet or a translation available. Basically, the difference between the AQHI and the AQI, and most of the time when people refer to the AQI, they're referring to the US EPA AQI, is that the AQI is based on standards. So each pollutant in the index, so PM 2.5, ozone, nitrogen dioxide, etc., the concentration at a given site is compared to the standard for that pollutant. So the pollutant that's highest relative to its standard is the one that determines the index value. And so this is one of the issues that the AQHI was intended to address, is that to try to address the impacts of the mixture rather than just the single pollutant that's highest relative to its standard. And the other issue being that, as I indicated earlier, the evidence at this point really indicates that that air pollution health effects occur with no threshold, so there's no truly safe level of exposure. So we wanted to, in creating with the AQHI, move away from the idea of calling, air quality good or safe, to this idea that there's kind of a gradient in risk from low risk to very high health risk. So that's really the main difference. And I'm just seeing a question there, and again, it just disappeared about the.
It's from
heat
Tom.
index.
To what extent does the heat index, including humidity, affect air quality indexes, or has that combined index even been created?
Yeah, that's a great question, and that's kind of been a bit of a holy grail. That's something that's been talked about for many years, trying to integrate the impacts of air pollution and heat, because as we talked about earlier, often, especially when air pollution is related to wildfire smoke, you have extreme heat and high risk air quality conditions occurring together. But unfortunately, that's not something that's been developed to this point. One of the issues, I think, is that we have a hard enough time understanding and quantifying the impacts from air pollution and heat, and quantifying the joint impacts is even that much more difficult. So I think we try to do our best in terms of trying to integrate the messaging related to heat and air quality, recognizing that they often are issues together. But just from a technical point of view, it's just been too difficult to this point to try to accurately reflect the joint effects in some kind of joint index. Was there anything else, John, at
No.
this point?
No.
Okay. So the next, in terms of being aware of air quality conditions, is Environment and Climate Change Canada's firework model, and what they use that to produce a smoke forecast. So this is the 72-hour forecast currently across Canada. Oops, sorry. This page up here again. So you can run their animation that shows how the smoke plume is expected to travel over a 72-hour period. And one of the challenges, though, with this interface is that it only allows you to zoom in to specific regions. So if you want to look at Ontario, that's as far as you can zoom in. And there's no kind of base map that allows you to, say, locate a specific location. You can see the animation still at this level, but that's about it in terms of being able to zoom in on specific locations. And so Firework it's a great model, but the interface, unfortunately, at this point is a little bit so-so in terms of user friendliness. And so next we have the Fire Smoke site, which is based on UBC's Blue Sky model. And both John and I showed some static images from this earlier. And so again, it's similar to the Environment and Climate Change Canada forecast, but the interface, in my opinion, is much more user-friendly. You can zoom into specific locations more easily, and there's a base map that shows you exactly where you are in terms of if you want to look at the exposure at a certain specific location. Now, I understand from my air quality modeling colleagues that the Blue Sky model that's underlying this website is not quite as strong as the Firework model that Environment and Climate Change Canada uses. But as I said, the interface is much more kind of user friendly. And then finally, the University of Northern British Columbia has created this low-cost sensor map. So this is basically crowdsourced data from low-cost monitors that just members of the public have deployed, say in their backyard or whatever. And you can see this is just a static image from the website, but they're the agency or federal reference monitors, like the ones I was showing you earlier, the NAP sites in Canada, and then the purple air sensors and these sensors called the air quality eggs that are available for, say, a couple $100 that people can deploy in a location of their choosing. So just to look at the actual interactive map. Just taking a little bit of time to load here. I'll just wait a moment. So again, this shows all of these crowdsourced sites where monitors have been deployed. So you can click on a specific monitor to get additional information. So it says something about the location, the history of observations at that site. You can look at the time series plot over time, and you can see how high some of these values have gone, up to close to 1,000 micrograms per meter cubed, as an hourly average, I believe. And one other important point about this website, the UNBC website, is that these low-cost sensors are, you kind of get what you pay for. They're not as accurate as the monitors that are deployed by government departments to monitor air quality. So there is a correction that's applied to the raw data. And so this should be more accurate than what is the raw information coming out of these individual low-cost sensors. So just another source of information about exposures. In terms of other more specific interventions, portable air cleaners that use a HEPA filter, there's good evidence that they reduce exposure and adverse health effects. And especially if a room inside a home can be sort of designated as the clean air space within the home, and because there's a limit to how large an area these air cleaners can clean effectively. There's also some evidence that homemade box fan air filters can be effective if commercial units are not available. And so these are basically constructed with a box fan and applying a HEPA furnace filter. And there are various kind of methods that have been used to configure the filters. But yeah, as I indicated, there is some evidence that these are effective as well compared to commercial air cleaners if those are not available. Just caveats though, in terms of the issue that you're obviously taking something, a box fan that wasn't designed to have a filter or multiple filters attached to it. So you just need to be cautious and recognize that you're using something in a way that it was not intended to be used. And finally, like John was mentioning, he needed to do when he was in Edmonton recently. Yeah, and I just seeing the OHCOW instructions on those homemade box fan filters. And the yeah, so the one that was mentioned in the message there is a particular configuration where there are multiple filters that are configured in a certain shape around the box fan, as opposed to a single filter applied to the fan, like I showed in the image. So yeah, just the last point about N95 respirators for if you do need to be outdoors and can't remain indoors away from wildfire smoke, and obviously the importance of ensuring a good fit of the mask without leakage for maximum effectiveness. And sorry, again, I saw a message pop up, John.
It's a bit of a comment.
Okay.
Question about relaying the message to general public. I'm always shocked at how few people wear any respiratory protection on the streets and play outdoor sports during bad air qualities. What are our steps forward in terms of public outreach? Probably what your career has been about.
Yeah, that's right. And I tend not to be so directly involved in kind of day-to-day outreach, but I know, for instance, in BC, where, unlike probably Southern Ontario, uh, wildfire smoke is pretty much a constant issue from year to year. And so I think you probably see more public-facing information. I know the BC CDC, the source of this information about face masks that's shown on the screen, they have a tremendous amount of information in multiple languages available on their website. And, they're very active in the media in trying to get this information out to people. And similarly, Health Canada and Environment and Climate Change Canada on their websites provide, a considerable amount of information on measures to take in response to wildfire smoke. And since the season has been so exceptional, the Public Health Agency and the Chief Public Health Officer, Teresa Tam, has also become involved in formulating a response to try to be more active in terms of ensuring people are prepared to deal with wildfire smoke as the frequency of these events increases over time. So yeah, I think you're right that we can always do a better job of making people aware of what they can do to increase their own resiliency. And I noticed a comment there that WorkSafe BC also provides some information. Now, I haven't worked in occupational health or occupational medicine for a little while, but I just wanted to finish off with a few words specifically about the occupational context. And this is really just reflecting a few tidbits that I've encountered more from a federal government perspective. So I'm sure you're all aware that about a year ago, IARC classified firefighter exposures as a group 1 carcinogen, so sufficient evidence for cancer in humans. And then in a similar sort of timing, just this June, royal assent was given to this private members bill on establishing a national framework for prevention and treatment of cancers linked to firefighting. So basically the scope of the bill is to develop a national framework that could include measures around supporting research on firefighting and cancer, identifying training and education needs for healthcare and other professionals around these issues, recommendations around screening for cancer in firefighters, promoting research and improving data collection that can be used to conduct this type of research. And then also knowledge sharing around prevention and treatment of cancers in firefighters, and looking at also standards for recognizing cancers as occupational diseases across the country. So in relation to these two developments, the IARC decision and this bill on developing a framework around preventing cancer in firefighters, Health Canada held a workshop in December of 2022, funded jointly with the Ontario Occupational Cancer Research Centre. And so there are around 70 participants, including provincial health and safety authorities, academic researchers working on firefighting and cancer, federal departments involved either in firefighting directly or research on firefighting and or cancer epidemiology, as well as stakeholder organizations. And some of the priorities that were identified around surveillance and screening, not just disease incidence, but also biomarkers of exposure and effect, and noting that there's a real lack of information for certain subgroups of firefighters, so women, Indigenous firefighters, and then military, aviation, volunteer, and wildland firefighters in particular. From an intervention and exposure mitigation point of view, the need for intervention research, looking at efficacy of personal protective equipment and standard operating procedures, and also looking specifically at post-event interventions to reduce exposure. And finally, recommendations around communication and knowledge transfer. So just examples around effective communication around screening results, trying to help individuals interpret those appropriately. And then obviously knowledge translation, working with labor groups and firefighter organizations. So just unfortunately ending on kind of a sad note that we obviously know that firefighting is a hazardous occupation, and sadly, just in the last week or so, there have been 3 fatalities, one in the interior of BC, also in the Northwest Territories, and just a day or two ago, a pilot in Alberta. So sorry to end on kind of a sad note, but that's really the reality of firefighting as a occupation, in particular, as we've seen in this record-breaking season, the real direct impacts on firefighters themselves. So that's pretty much all I had to say at this point, but I'm happy to take any additional questions or comments.
Yes, there was another question from Lynn Nelson. What are the particular risks facing farm workers?
Yeah, that's an excellent point, and I know, especially, I think it came up in the context of the COVID pandemic. Early on, we saw that, in particular, migrant farm workers in some areas of the country were particularly at risk from COVID because of their living conditions. And in places like California and Western Canada, where they're also exposed to wildfire smoke, that it was kind of a double whammy at the time, where they're obviously outdoors more than most people and involved in more intense physical activity. So yeah, it's certainly a major issue in terms of their exposures. Just in terms of the amount of time that's spent outside and the degree of physical activity that they're being engaged in. And I think one of the other issues that's important, particularly for that, especially precarious group of migrant farm workers, is that they'll often have less access to personal protective equipment. And again, that was something that really became evident, especially during the COVID pandemic. Yeah, so thanks for bringing up that point. That's an important precarious group to be concerned about.
And speaking of COVID, from Tom, is there any evidence of the overlap of long COVID and wildfire smoke?
I haven't seen anything specifically about long COVID and wildfire smoke, but I know there have been some studies that have looked at whether wildfire smoke increased the risk of developing COVID or severity of COVID. And there hasn't been a huge amount of evidence yet in that area, but that's certainly something that there was a lot of interest in investigating. And as far as I know, the evidence has suggested that, not surprisingly, wildfire smoke exposure did increase the risk of COVID infection. And as I mentioned, just in terms of our understanding of the mechanisms through which air pollution contributes to adverse health effects, we've known for many years that air pollution and PM 2.5 exposure does impair our ability to deal with infections, so increasing the risk of respiratory and other infections.
Yes, I think there were quite a few papers that looked at PM 2.5 and infection rates and weather
Exactly.
patterns. Yeah. Are there any other questions? If not, or if you do, just write them down. I thought I would also give some hygiene reflections on the situation and flesh out. I know there's probably some hygienists who are online, and I thought I'd flesh out some of the things Dave was talking about and how they apply to Ontario. Dave showed the federal website for current and forecast air quality, but there's an Ontario one also. And they also provide a map that gives the AQHI for Ontario. And if you want, you can change that to PM 2.5. It's not colored in as nicely, but and there's also a table, and beside each table you can click an icon and it'll give you the tracking of the last 3 days of that. And you can go back further also. Also, we were talking about measurement cues, but it's interesting to note that a long time ago, people were trained to measure air quality by visual cues. So just looking up, I think in Southern Ontario, we noticed some spectacular colors of the sun during the sunset during this time. But in the Netherlands, they actually experimented with crowd sourcing using a cell phone. You add a little clip onto your, I think it was made for an iPhone, and point it in the air in 2 directions, and that would give an estimate of the PM 2.5 in that area. Interestingly, the original paper that Dave wrote about air quality had proposed to color it by the color of the sky. I thought that was quite an interesting. It's too bad that that didn't maintain, but
Actually, maybe I can just comment on that, John.
sure. Yeah.
Because that's kind of was an interesting development over time. And the idea at the time was that, we were trying to create a new type of index. And so we wanted to depart from the standard sort of stoplight colors that are associated with the AQI and other types of indices. So one of the sort of graphic design folks came up with this idea of trying to reflect the sky color. And I think one of the issues that that wound up changing that a little bit. I mean, we try to still adhere to that as much as possible, but I think there are just some issues around rendering these colors accurately and distinguishing between the different levels. So the way that it's configured now is, as I understand it, the best that could be done given sort of color rendering capabilities to try to try to stick to that idea of reflecting sky color, but not perfectly, as you pointed out.
Yeah, it's kind of hard to tell the 3 and the 4 apart from each other in this one.
Yeah.
The contrast. For those who are looking at buying their own particle meters, there is a criteria for evaluating the accuracy of them. And they have one of the criteria is a coefficient of determination, or R squared, which is part of the correlation. And it has to be greater than 70%. And they have a list online, and I picked one that's quite popular, Purple Air, and it evaluates them for PM 1, 2.5, and 10. And you can click on an evaluation sheet, and it gives all the details. Here you can see the 3 Purple Air monitors that they tested in the lab and how they compared. And then they also have field evaluations where they take them outside. Here you can see them again outside at a weather station and compare them to the weather station. And this one compared quite well. The cost is amazing. If you look at the list, there are some very expensive monitors that didn't do well, and there are some very cheap ones that did do well. So I highly recommend you look at this. I also just want to share a bit of a personal experience we had. We were at home, and we sleep with the windows wide open, and we woke up around 2 o'clock, both of us with pain in our sinuses right across the bridge of the nose, and a plastic odor and a sore throat. And later, when I checked the levels in Brantford, where I live, the levels peaked at 191 at 2 o'clock, the measurement, and you can see it rising quite quickly after midnight. So that change must have also had an effect. And I have some of my hygiene stuff from the clinic lying around, and so I thought I would take some measurements. And what we did is we closed all the windows and turned the fan on in our, and inside and outside were about 0.3, and you can see we quickly dropped over a couple hours to 0.16, and our symptoms resolved at this point. And later on, I turned on the AC, which makes our fan go faster, and you can see the outdoor measurements compared to the indoor measurements. And we have a MERV 11 filter on our furnace. However, one of the negative things about sealing up is the carbon dioxide starts climbing. You can see we started off below 500 parts per million and ended up around 1,000 parts per million. And that's the trade-off you have to make sometimes in these situations. ASHRAE has a guideline for air quality, and it includes a clause about outdoor air quality. You have to take into account the quality of the air, because part of the ASHRAE standard is how much outdoor air are you bringing in and how you have to clean it before it gets circulated. So putting in at least the practice is putting in a MERV 8. However, I've seen workplaces with MERV 4, but for a fire type particulate, you probably need at least MERV 11 to 13 as a minimum. Here's an example of the exposures that happened on June 6th in downtown Ottawa, where the levels went up to 500 microns per cubic meter, and the average over the whole day was 211, which are far above the Canadian air quality standards. However, when you plot them out and compare them to the quality standards or an AQHI of 10, you can see that they're more than double that. But when you compare it to the occupational standard, which is 3,000 micrograms per cubic meter in Ontario, you can see that these exposures don't even, and that's an 8-hour average instead of a 24-hour or a 1-hour average. And even the Xerox standard, which we recommend as a health-based standard at 400 micrograms, is still double what Ottawa experienced in those 24 hours. Now here is a, we asked Audrey Samaragiesi to join us, but she was on vacation and so were all her co-authors, but she did an evaluation of environmental and occupational short-term exposure to airborne particles and how that had affected lung functions. And she did a systematic review and analysis. And what she found was that the effects in the environment are an order of magnitude lower, earlier than in occupation. And she speculated as to the reasons, and she thought that maybe it's due to a nonlinear relationship or differences in the study design or methods. But this is one thing that always surprised me as a hygienist. When the environmental people like Dave are reporting health effects below 10 micrograms per cubic meter, meanwhile I worked in a foundry before I worked in the clinic, and the average exposure there was about 700 micrograms per cubic meter. Maybe not exactly the same type of dust in the air. It was predominantly silica, but it also included smoke because in a foundry you pour iron and there's a lot of fire and smoke inside. But I often wonder why the big difference. Now, we've all seen the hierarchy. Yes.
Oh, sorry. Can I just make a quick comment on that?
Yes.
I think that's a really interesting point, an important point. And I didn't get into the sort of details about how the evidence around the shape of the exposure response relationship has kind of evolved over the years. But yeah, there's been evidence recently that the shape of the exposure response may be not exactly linear, but steeper at lower concentrations and leveling off at higher concentrations. And so it's been interesting, in the kind of global context, Canada has relatively low air pollution exposures relative to, around the world, like Asia and Africa. And so when you look at a kind of global level, you're seeing these steeper exposure response relationships in Canada, even compared to some of these other countries. And there's a process or a project that's initially was managed by the WHO, but was subsequently funded by the Gates Foundation, called the Global Burden of Disease Project, that tried to or tries to in kind of a comparable way look at the impacts of different types of exposures, whether it's smoking or air pollution or dietary exposures, and quantify them in a comparable way. So one of the exercises that was done as part of that process was to sort of integrate the evidence, including outdoor air pollution exposures, indoor air pollution exposures from, especially in developing countries where biomass is used indoors for heating and cooking, and then also from environmental tobacco smoke and actual personal smoking. So there was something called an integrated exposure response curve that was developed, looking at all those sources of exposure to PM 2.5. And again, this idea that the exposure response curve was much steeper at lower concentrations and then leveling off at higher concentrations. So sorry to digress on that, but I just thought it was a good time to make that point.
I had a couple of slides on the maple study that showed that too, but
exactly, yeah.
I figure I didn't have time. Just quickly go through a few things and then we'll talk answer some questions. Applying the hierarchy of controls, engineering controls, filter, rescheduling work to lower exposure times, and the least effective, but still necessary in many cases, is wearing a respirator. Filters, you need to go on the roof and open up your HVAC system and look inside and check out what kind of filters you really have. Even after the pandemic, where everyone was told to try to get a MERV 13 filters, I'm still finding MERV 4 filters kicking around. And this was just a few months ago, which only stops butterflies. Just to give people an idea what MERV rating is, a MERV 4 is like wearing a gator mask, which we know didn't do much. In fact, if you cough through a gator mask, you actually create more particles than original. A cloth mask is up to about a MERV 7, procedural mask about a MERV 10. An N95 respirator is anywhere from MERV 13 to MERV 15. And an N99 is like a HEPA filter. If you have a valve on there, that is fine for smoke, for biological or containing biological emissions from yourself to others. It's like a surgical mask. And a surgical mask, I see Simon, I believe, is on the line, and I got this from him, is about the same as putting the hand over your mouth. Can you imagine what we did during the pandemic? And for those who don't have MERV numbers on their filters, here's a conversion slide. These slides will be available, so you can look at the type of grading system you have on your filter. Portable air filters, they need to be properly sized. Often people will buy them too small and then turn them down because they're too noisy. And they need to be maintained, and poorly maintained units actually put out more particles than they take in. And I've confirmed this with my own measurements. So you need to follow the manufacturer's guide for replacing the filters. And just some ideas about the square footage that you need, and also the decibels. 70 decibels is quite annoying, whereas the background that people can usually manage is about 40 decibels. And Dave mentioned the DIY air cleaners, the boxes. And here's some examples of that. And Dave had a picture of this one too. I got a few more. I like the one about not sleeping with the mask on. And then during the pandemic, we also created this picture here that you need a fitted fitted N95, and it needs to be tight. And here's the infographic that we just put together about the particles themselves, some of the signs, who's vulnerable, some prevention ideas for working outdoors and indoors, and responsibility, and finally the AQHI recommendations. So I want to thank and recognize Leslie Shimmy for the graphic artwork that she did on that. But so I'll stop there, and I understand there's some questions. Will these slides be available? Yes, they will. They'll be on the website. And Simon says that, yes, I fit tested my hand over my mouth for a comparison with the surgical mask. They are about the same due to the poor seal to the face. Okay, Simon also asked, is there a place for citizen science monitoring in this? I was at a conference in Europe where a spectrometer that could be clipped onto a cell phone camera could be used. There was a cross-Europe evaluation project about a decade ago. It might be the same device that I showed, actually, because it was about 10 years ago. I think they have run into accuracy problems with this, and so it's kind of stalled. The technology is there, but getting something that will give you consistent results is a bit of the problem. And what does higher carbon dioxide do? Higher carbon dioxide is kind of an indicator substance that we measure to evaluate indoor air quality. If you're delivering the amount of outdoor air that ASHRAE recommends for your workspace, the carbon dioxide level should be generally under 1100 parts per million. And so if they go over that, it means you're not diluting the emissions that come from people, from furniture, building materials, etc., and they can build up to points where they could be irritating. There's also been studies that show children in school perform their schoolwork worse in poor air quality conditions than good air quality, so it can affect cognitive processes. So there are, but as I said, given the problems associated with high levels of particulate from wildfire smoke, it may be a trade-off that you need to make during these episodes of high smoke. If they happen more often, obviously, having a better filtering system on your ventilation system to take out the outdoor particles before they're circulated through the building will allow you still to keep the outdoor air supply level for diluting the emissions from indoors down, and yet keep the particles under control so you won't have to make a trade-off. And let's see, what do we know about gas dispersion versus particulate dispersion and their relevance relative to the proximity of a fire? I assume this is environmental, so I'll turn it over to Dave.
Excellent question. Unfortunately, I'm not an air quality modeler, so I'd have to defer to my colleagues on that one.
Actually, Dave, I looked at the CO2 or carbon monoxide. We only have 2 stations in Ontario that measure carbon monoxide, and I tried to see if there was a correlation with the particulate, and sometimes there was, and sometimes there wasn't. I blew away those slides in the in the interest of time, but I did notice that the carbon monoxide level increased almost a part per million. Now I know in your article you were dubious about anything below 1 part per million and the accuracy of them, but your paper was written in 2008, and I think there's been some increase in technology so that they are able to. So we did see both in the time series, if you plot out the carbon monoxide levels and the particulate 2.5 levels, they go together. And when you look at the correlation, I think it was around 0.7 or 0.8. But it wasn't every time, every episode. But some episodes followed each other quite nicely. So I'm not sure what that means.
In general, the CO monitoring has been cited mostly to detect impacts from vehicle emissions, and I think just the number of CO monitoring sites tends to be smaller than for some of the other pollutants as well. So I think probably the other pollutant that would be of greatest interest other than PM 2.5 in relation to wildfire smoke and also coincidental heat exposure would be ozone. But offhand, I can't sort of comment on how ozone tends to disperse relative to PM 2.5. I'd need to look into that a little bit further.
Okay, another question from Frank. If you're considering thresholds for action based on AQHI, AQI, which averaging times are the most relevant, or should both I believe the AQHI is 3 hour, but the smoke adjusted one is 1 hour. And there's also some people use 24-hour averaging. Dave?
So yeah, I can speak to the AQHI. One of the reasons to initially proceed using a rolling 3-hour average concentration was just to sort of stabilize the value so that the index wouldn't be kind of jumping around in relation to short-term variations in exposure. But the experience with wildfire smoke meant that often the AQHI would lag too much, around rapidly changing conditions. So that's where the modification was developed using 1 hour average PM 2.5 to try to be more responsive to short-term changes in the context of wildfire smoke. And I know in some areas, like in BC, I'm not sure if it's still done, but there used to be also air quality advisories issued based on the 24-hour average concentration, like you were mentioning, John. And one of the issues around that is that, obviously the 24-hour average has even more of a lag. So you might see that that's still elevated when short-term exposures have decreased. So there may be some communication issues around that. And then vice versa, that the 24-hour average may remain low when you're already seeing 1 hour or 3-hour average values increasing.
The other thing, if I may add, is listen to your body. If you know the health reserve that you have, and if that's a small reserve, then you need to look for the symptoms that we've outlined and take action quickly. The reverse of that is also true, I think. Sometimes some of these things can be so worrying that the stress can actually probably, for a healthy person, be more concerning. I had a colleague who's a marathon runner ask me, he was quite concerned about running. And I said, well, it may affect your performance, but if you don't feel any symptoms, you can use that as your guide. That's obviously not a medical determination. Maybe Dave wants to comment and correct me on that, but listening to your body.
Yeah, that's kind of one of the rules of thumb that we advocate with the AQHI. And again, because of this underlying premise that you can see effects even down to very low levels of exposure. So, generally at the lower levels of exposure, the benefits of outdoor physical activity are going to be much greater than the risk, the sort of offsetting risk from air pollution. But again, the situation, like you were indicating, John, varies from individual to individual. So an otherwise healthy person is likely to be able to tolerate higher levels of exposure. But having said that, even otherwise healthy people, for no kind of reason that may be evident to themselves, might be more sensitive to air pollution than another otherwise healthy individual. So again, getting back to what you were saying, John, about sort of listening to your body and determining your own degree of sensitivity.
And if I can add one last thing, my daughter phoned me up and asked me, should I be working from home? And she lives in an apartment that has no forced air. Or should I go to my office, which was in a hospital in Montreal, where I assume they have good filtering. And, I told her, you may as well go to work since your filtering is better there, which is kind of the opposite of what we told people when the pandemic was on.
Right.
Okay, well, I really thank you, Dave, for coming back for a time with us, and we really appreciate it, all that you've put together, and your your career in this field, really providing Canadians with the AQHI and showing how it affects our economy and our health and our lives, and providing educational materials to help the public understand the risks and also what to do about it. So thank you for coming, and thank you for all your work on this.
Thanks very much, John. It was really great to see folks again, and let's not wait another 30 years to be in contact with each other.
No. And thank you, audience, for some very good and stimulating questions and comments. And I don't think Valerie's here anymore, but I'm not sure about upcoming ones. Perhaps Jennifer, do you know of
I'm still here.
Oh, you're still here. Are there any
Yeah.
upcoming events?
Good question. Yeah, we're working on a heat protection one for Friday, August the 18th, trying to include some people from the US who have regulatory standards to understand that. And then Natasha Lukart from the Ontario Federation of Labor is going to talk about the campaign they have around heat protections for workers, since it becomes even more critical than ever this summer. And we're also working on a school safety indoor air quality one, which may include going over the new ASHRAE standard for infectious disease prevention. So stay tuned. It'll be on our website, and sign up for our newsletter, and you can get the information that way. And otherwise, I want to thank John and Dave for a really great and really informative discussion on something that's so topical across the country and in so many workplaces, indoors and out. So thanks again, and thanks to everyone who's here, and have a safe and happy summer and a good weekend and all that. We'll say goodbye. Thanks again.
Thanks again.
Bye.
Bye, everybody.